Good morning and welcome to the Medicinal Cannabis Symposium. Unfortunately, Lucy, my wife, is suffering from a huge migraine. It's absolutely smashed her and she's gone to bed, which is a shame because she knows absolutely everything that's going on here because she put it together. So anyway, hopefully she'll get better in the next hour or two. And like everything, when somebody starts something like this and runs it from the word go, pretty much on her own, she's indispensable when it comes to opening up the damn thing. Okay, so please bear with me. I've got her opening address here, which will only take a couple of minutes, and I'll just read that out if I may. So, firstly, to our VIPs, who we will meet in a moment, to our international and Australian speakers, to the health professionals, and last but not least, the attending patients and their carers that are here today, and thank you for coming. And I'm sure that you won't be disappointed with the program. I'll just take a couple of moments to reflect on what has prompted United in Compassion to put on an event such as this. The fact is, it shouldn't be so hard to show compassion for people who are suffering, but the politics of self-interest, some historical, some recently invented, has gotten in the way. An enduring war on drugs that put cannabis in the same class as heroin, despite it being remarkably safe and non-toxic. The reefer madness era that inflicted racism and hysteria on the general public from the top down, and from which it is still alive and well in Australia, in Australian political circles. The blanket prohibition, which has meant that scientific research into therapeutic use of cannabis was stifled, but research into harm's way was encouraged and exaggerated. The outdated UN Single Convention, which deemed cannabis to have no therapeutic value in 1961, decades prior to the discovery of the for Christ's sake, I know the word, I know it, the endocannabinoid system. I'm not going to say that now, am I, for the rest of the meeting? Anyway, nevertheless, politicians and bureaucrats will use as an excuse for inaction at every time. The recreational cannabis movement, which allows medicos and government to postulate that medical cannabis patients are sure to be recreational users in disguise, which is so untrue. Cannabis use is not about getting well, but about getting high. This is what they're saying. The influence of the big pharmaceutical companies and the rise of the opiates as the medico's drug of choice. The failure of the medical profession to see that through the rhetoric and keep up with the science, coupled with the choice of some health professionals to dismiss all things cannabis. This commonplace attitude was summed up accurately by T.B. Strauss in 2016 Cannabinoid in Medical Practice, when he said, "I have come to see the willful ignorance about cannabinoids as a form of patient abandonment. The message to the patient seems to be, figure it out yourself, not to tell me about it. Such a stance is not consistent with the highest values and aspirations of medicine." And so the list goes on. So here we are in Australia today, years after the politicians started to acknowledge that there was a need to address the human rights of suffering patients and make cannabis available to them. Today we see the government-appointed advisory council stacked with many anti-cannabis appointees who have strong affiliations with the pharmaceutical industry. Today we see smoke and mirrors, a mirage of a sham of a policy which has so largely been influenced by all the above and which keeps patient access to legal forms of cannabis as far, or if not further away than ever. So let's peel back to why we are here. In 2014, the cannabis gave my dying son quality of life. It stopped his previously uncontrolled nausea and vomiting in its tracks. It gave him an appetite. It helped him sleep. It helped his pain and allowed him to rely less on the opiates that caused so many horrendous side effects, and gave him hope. In the 4 years when he was dying, the last year, would you believe, was our best year with him. The best year with him on the last year of his life was because we put him on the cannabis, and it made him live well. For the others, it is the chance to stop brain-damaging seizures, painful spasms, control post-traumatic stress, manage chronic and neuropathic pain disorders, and the list just goes on. Our federal government has said it recognised and reacted to this suffering. It took the political accolades for responding with compassion, so now it must take the criticism for the ineffective policy, the lip service, the protection of industry, and the betrayal of patients. The voice of the majority has been stolen because the public policy inflicted on us is already broken. So let's put the focus back on the patients, back on the science, and back on the reason we need to do better with cannabis reform. It is called compassion, and if a clever and innovative country such as Australia can't be motivated by looking after the sick instead of treating them as criminals and keeping them in the grip of the black market, then we have a very big problem. And that may need to become an election issue in 2019. So, without further ado, thank you for coming. Thank you for your interest. And let's all work together for public policy that reflects the dignified alleviation of suffering with compassion and empathy. And it's such a shame she's not here. Lucy, that is. I would now like to introduce the host for the day, and I'll just tell you a bit about John. John Toomey is a health educator, a professional speaker and trainer, has worked extensively as a health and wellness commentator. He holds a degree in physical education, has presented seminars throughout Australia and internationally, and is widely published. He was one of the pioneers of fitness industry training courses and has published a fully accredited course in wellness leadership. He currently teaches a self-development course which involves personal exploration of human consciousness. The course is presented in 76 countries. So welcome, John, and thank you for being so generous with your time. John will host today and tomorrow, today and Sunday. Helen Kapelos will host tomorrow. John?
It's all good.
Okay, mate. I'll leave it with you.
Thank you.
John.
Welcome, everybody. First, I'd like to thank you for overcoming whatever challenges that you needed to overcome to get here. Some of you have come from far away. Some of you probably travelled across 3 suburbs. But whatever it took, welcome. For those of you who are not from Melbourne, welcome to the world's most livable city, where the coffee's great, the football is even greater, and the weather is extraordinary. I often tell people these days that if you really want to experience traditional Melbourne weather, you have to go to Sydney. Today we come together to learn, to gather information, to share ideas, to support each other, and become the best agents of change that we can possibly become. Societies sometimes get locked down in ethics that no longer suit the current society. And it takes courage and it takes perseverance to push through the fixed ideas and the rigid viewpoints that seek to prevent change. So I invite you all, as we sit here today and we hear from some wonderful speakers who have got some incredible things to share with us, to not just open your minds, but please open your hearts. Because the people that we seek to educate They're not bad people. They're just stuck in some viewpoints that need to be explored. So to open, we have a video from the Honourable Jill Hennessy, Victorian Health Minister. Unfortunately, she couldn't be here today. We have a few politicians who couldn't be here today, and I'm sure it's not because Bronwyn Bishop's using the helicopter. So Jill Hennessy has a piece for us. She's coming in via video. She can't be here because Victorian Parliament's been called for an extra day and she has to be there. That's her public role. So please give your attention to the screen now.
Thank you and good morning, everyone. I want to thank United in Compassion for the opportunity to officially open the UIC Australian Medical Cannabis Symposium here in Melbourne. Like United in Compassion, the Victorian Government has been at the forefront of driving the change in attitudes as well as access to medicinal cannabis in Australia. The Andrews Government is committed to providing access to medicinal cannabis to those in need. In 2016, we introduced the first access to medicinal cannabis legislation in Australia, and I'm delighted that the Commonwealth Government has also opened up access pathways at the Commonwealth level and reduced the import restrictions, making imported medicinal cannabis more available to more Australians. Victoria continues to remain at the forefront of the push to provide medicinal cannabis to patients in need in Australia. And earlier this month, you may have seen media footage of the first medicinal cannabis crop being grown right here in Victoria. We are the only state in Australia that is undertaking the very groundbreaking work to formulate and manufacture medicinal cannabis products for children with intractable epilepsy. Victoria holds the only manufacturing permit issued to date, which means that we'll be the first to produce a locally grown, legal, safe, high-quality product with consistent dosing and known composition. Being the first mover means that Victorian patients will benefit sooner, but it also means we've had to find the practical and regulatory pathways through every issue against a backdrop of fast-developing regulation, science, and clinical practice. And as challenging as this has been, the good news is that we're learning a great deal that will benefit everyone here as the medicinal cannabis industry matures in coming months and years. While we develop our Victorian product, I know that for many patients, access can't come soon enough. And for some very ill children, every day without access to these products is a day too long. That's why in March this year, our government fast-tracked access to imported product for 29 very ill Victorian children who simply couldn't wait for the development of a Victorian product. And we're determined to ensure our product is of the highest quality and safety. We're in the process of rigorous formulation, testing and quality control to ensure that the product that we provide for Victorian children is safe and of a reliable quality and known composition. A product that doctors can prescribe to their patients with confidence, and a product that parents can provide to their children with confidence, knowing the exact composition and the correct dosage for their child. Looking at the agenda over the next 3 days, it's really encouraging to see a strong focus on the evidence base from around the world. The Victorian Government established an independent medical advisory committee to ensure that we are constantly reviewing new research and evidence as it emerges and receiving expert advice on expanding patient access based on the evidence over time. Events like this one are a fantastic opportunity for the public, patient advocacy groups, clinicians and researchers from around Australia and the world to share vital knowledge and experience. So I want to thank you all so very much for your time this morning. I hope you enjoy your stay in our beautiful city and that you leave this important symposium feeling optimistic and inspired about the future when it comes to medicinal cannabis, because I believe it's a very bright one.